This is an example of a uterus that has been sectioned to reveal an endometrial carcinoma. For orientation, you can see that the uterus has been bivalved. The cervix is here, and the ovaries are here. This is the endometrial cavity. Endometrial carcinoma is the most common malignancy of the female genital tract. Endometrial carcinoma usually arises in postmenopausal women who present with vaginal bleeding. The two main types of endometrial adenocarcinoma are endometrioid and serous carcinomas. Endometrioid carcinoma is more common and arises in the setting of endometrial hyperplasia. In contrast, serous carcinoma arises in the setting of endometrial atrophy. Both types can form broad-based polypoid masses or spread diffusely through the myometrium. Extensive myometrial invasion is associated with uterine enlargement. This specimen shows multiple masses with a friable texture. Depth of invasion is an important prognostic indicator. It can be challenging to recognize the depth of invasion on a gross specimen once it has been fixed. Here you can see the tumor in the endometrium. However, it is not possible to determine how deeply it is invading. A histologic section will be necessary. Microscopically, the majority are conventional adenocarcinomas. Tumor can spread to regional lymph nodes and may metastasize to the lungs, liver, bones, and other organs.